Hi, everybody. Thank you for joining today. We are proud to present Dr. Todd Robinson in our Life After Cancer Patient Education Series here at Baptist MD Anderson Cancer Center. Today, we're going to be talking about a topic that's near and dear to my heart, integrative oncology. And Dr. Robinson is the expert that will be sharing his knowledge today. Dr. Robinson earned his undergraduate degree from St. John's College. It's a small but highly respected liberal arts college, considered some of the most contrarian college in the United States. His undergraduate studies were at Mayo Clinic, Jacksonville, and he received his naturopathic doctorate at Bastyr University. He is a fellow of the American Board of Naturopathic Oncology, and he's the immediate past president of the Florida Naturopathic Physicians Association, which is an organization he continues to support their efforts in advancing naturopathic medicine in Florida. Thank you so much for donating your time today, Dr. Robinson. Take over.
Okie dokie. So yes, thank you for that introduction, Heather. As mentioned, my name is Dr. Todd Robinson. I'm a naturopathic doctor and I'm a naturopathic oncologist. And I have the distinct honor of being here today to talk to you about integrative oncology. This is something that's near and dear to my heart as well. So let's get started. The first place that I would like to start is a couple of important definitions. The work that I do, I have found that not everyone is clear on what integrative medicine is, what integrative oncology is, what naturopathic medicine is, what naturopathic oncology is. So I would like to talk briefly about what those things actually are before launching into sort of the meat and potatoes of my presentation. So, definitions. So it might surprise you to learn that there is not a single sort of formal definition as to what integrative medicine actually is. There's a lot of professional organizations who are working to advance the practice of integrative medicine in the United States that have put forth their own definitions, but there's not sort of one centralized, agreed upon definition. So there was a paper that was recently published that took all these definitions, pooled them together, and tried to look at sort of what the common characteristics or defining features were across all of these definitions. And so that's what this list represents. Integrative medicine focuses on the whole person. So a patient is not their disease. They've got a physical component, but a mental and an emotional and a spiritual component as well that needs to be taken into account when you're offering treatment for that individual. Integrative medicine also involves an evidence-informed practice. So integrative practitioners are perpetually looking to the evidence that's been published in peer-reviewed journals to see what the best practice actually is. What are the best recommendations that you can make for your patients? And in that respect, it's very common. It's a shared characteristic with conventional medicine. Conventional practitioners are often looking to the most recently published evidence to offer their patients the best advice possible. Integrative medicine also has an emphasis on health and wellness. So instead of having a disease focus, it's more about the person as a whole and this positive aspect of feeling healthy and feeling well and having a certain vibrant air about oneself that is helpful in terms of tackling certain lifestyle practices that can be helpful, so on and so forth. And I think a defining characteristic of integrative medicine is that integrative medicine specifically seeks to combine mainstream treatments with non-mainstream treatments. So an integrative practitioner is not necessarily going to discourage patients from drugs or surgery or radiation in the case of cancer treatment, but will also will also recommend lifestyle practices and supplements and botanical medicines that could be helpful for those patients alongside of those conventional treatments. So those are sort of the primary characteristics of what integrative medicine actually looks like. Now, when it comes to integrative oncology, there is a formal definition that's been published. This definition, I think, is very well put together. So integrative oncology is a patient-centered, evidence-informed field of cancer care that utilizes mind-body practices, natural products, and/or lifestyle modifications from different traditions alongside of conventional cancer treatments. So in essence, integrative oncology is the deliberate inclusion of natural and holistic medicine alongside of mainstream cancer treatment. So it's important to acknowledge that many of the conventional resources out there for cancer treatment are not the best at providing guidance on integrative medicine. And so here's some evidence to support that idea. A recently published survey of oncologists that practice in the United States found that only 41% of those oncologists discussed natural medicines with their patients. And of those discussions, only 26% were initiated by the oncologist. So the rest were started by the patient themselves. In that same survey, a majority of oncologists reported that they really hadn't received any education about the use of botanical and nutritional medicines, and they felt that they had too little knowledge to address the topic with their patients. So my point in bringing that information to the forefront is that integrative oncology requires an interdisciplinary team. So you want the best possible conventional medical oncologist, surgical oncologist, and radiation oncologist on your team, absolutely. But for an integrative approach to your treatment, you also need to rely upon other professionals, nutritionists, nurse practitioners, chiropractors, acupuncturists, etc., that can bring some of these different treatment modalities into the sphere of your cancer treatment. And so that sort of brings me back around to me. As Heather indicated, I am a naturopathic doctor and naturopathic oncologist. And in Florida, in Jacksonville, Florida, and the whole state of Florida, I'm a bit of a unicorn. I'm one of the very few naturopathic doctors that chooses to practice here. And I am, to the best of my knowledge, the only naturopathic oncologist in the entire state of Florida. So I would like to take a second to clarify exactly what it is that I do and what naturopathic oncology is. So the formal definition of naturopathic medicine is that naturopathic medicine is a distinct healthcare profession that focuses on the use of evidence-informed treatments like lifestyle medicine, clinical nutrition, botanical medicine, physical medicine, and in some jurisdictions, IV therapies and prescription drugs. Essentially, naturopathic doctors specialize in natural medicine. The training and education that I received focused on how can I use natural medicine to help my patients be healthier and achieve a greater state of wellness. As you can imagine, naturopathic oncology, therefore, is the application of naturopathic medicine in the sphere of cancer care. So naturopathic oncologists provide evidence-informed guidance on the safe and effective integration of natural medicine alongside of conventional cancer treatments. Here's a helpful graphic sort of picturing the lay of the land with all of those definitions. So the orange circle in the center represents the patient, the person who is most important in this equation. Outside of that sphere are the medical oncologist, the surgical oncologist, the radiation oncologist, and all of the allied health professionals that form the core of someone's conventional cancer treatment. A naturopathic doctor or a naturopathic oncologist can supplement those primary treatment modalities by advising patients on how they might integrate natural and supportive therapies into their cancer treatment. And the whole of that is what we would describe as integrative oncology. So integrative oncology is really looking at all of the tools that are available to help someone and bringing them together in an organized, safe, and effective fashion for the betterment of the care of that one individual. Now, I'm happy to say that integrative oncology is growing. A recent systematic review of the major cancer treatment centers in the United States found that increasingly the websites for these cancer treatment centers are presenting information on integrative medicine. And the majority of them provide services to their patients to some degree that allows for the education and dissemination of important information to cancer patients on the integration of natural medicine into their overall treatment plan. And this is undoubtedly being driven by patient demand. This is a summary of some of the research that's been published over the last few decades regarding the number of patients that are using and seeking natural medicines as a part of their cancer treatment. So back in 1998, it was estimated that roughly 31% of cancer patients were using some form of natural medicine. And as recently as 2017, that estimate has risen to 94%. So patients are seeking natural medicine as a part of their cancer treatment. And although it's slow, the conventional cancer treatment apparatus is responding. Despite the progress, I would argue that natural medicine, holistic medicine, integrative oncology is still a missing piece of the cancer treatment for the vast majority of cancer patients that are out there. Hopefully this presentation today will take one step forward in improving that situation. So next, let's talk about some of the treatment modalities of integrative oncology. What does integrative oncology use to help patients? One of the big areas to discuss is lifestyle medicine. So anytime I use the term lifestyle medicine, a lot of the people that I'm talking to find it confusing. It's a term that they've never heard before. Lifestyle medicine actually has a formal definition. There is an American College of Lifestyle Medicine, believe it or not. And lifestyle medicine is the use of evidence-based lifestyle therapeutic intervention, including a whole food, plant-predominant eating pattern, regular physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connection as a primary modality delivered by clinicians trained and certified in the specialty to prevent, treat, and often reverse chronic disease. So, distilling that down, lifestyle medicine includes 6 main modalities or 6 main focuses for people. Number 1, avoid risky substances. Number 2, eat healthfully. Number 3, form and maintain relationships. Number 4, improve sleep. Number 5, increase physical activity. And number 6, manage stress. So I would like to briefly talk about each of those modalities or each of those elements of lifestyle medicine as it relates to integrative oncology. So number 1, avoid risky substances. Of course, this includes tobacco products with their well-known connection to various forms of cancer, most notably lung cancer. This includes alcohol. Alcohol use is connected with an increased risk of developing cancer. And this includes other forms of sort of recreational drugs. One element that a lot of people don't realize or don't connect necessarily includes environmental exposures. So that includes environmental pollutants. So we're talking air pollution and water pollution and so on and so forth. It includes some of the chemicals we're exposed to in terms of the plastics that we use in day-to-day life. So plastic water bottles, plastic takeout containers, etc. It includes personal care products, so the shampoos and soaps and deodorants and toothpastes. And it includes some of the chemicals that are used in the production of our food supply. So all of those things and more create the sort of environmental exposures that we all have. And we are exposed to a wide variety of particular chemicals in our day-to-day lives. Now, it's common for some of the folks that I talk to be skeptical of that idea and say, oh, those chemicals are present in such small amounts, or they don't have a meaningful impact on human health. I'll be the first to say it's difficult to study the topic because it doesn't lend itself to the typical sort of reductionistic scientific study that often gets done and published, because it's a very complicated topic. That being said, there was a recently published study that looked at 8 hallmarks of environmental insults. So these are effects that certain environmental chemicals and pollutants can have on human health and the functioning of the human body. I'm not going to go through all of them, but it is an evidence base that establishes some form of biologic plausibility as to how environmental chemicals could be negatively impacting our health. There was also an interesting study published, and this is sort of the take-home point of that study, that looked at the cumulative and synergistic effects of different non-carcinogenic chemicals acting on different molecular pathways in the body, and how that could affect organs and tissues and cells, and plausibly conspire to produce carcinogenic synergies. So that is, yes, it's true that individual chemicals in our day-to-day life might be present in such a small amount and might not be carcinogenic in and of themselves. But when you combine them in the chemical slush that we're all exposed to, that combination could have carcinogenic effects. And then there was a recent systematic review that found, this was looking at people who consumed organic food. Increased organic intake was associated with a reduced incidence of certain health conditions, including, of note, non-Hodgkin lymphoma. So there is a substantial and growing body of evidence to suggest that environmental pollutants and chemicals can have a negative impact on human health, and that they're worth paying attention to. So that begs the question, what can you do about it? Well, there's only so much we can do about it, to be honest. So one thing you could do about it is move to the country. That's not practical for a lot of people that I know. It's probably cleaner as opposed to living in an urban environment, a city, for instance. It's probably cleaner to live in the countryside. That's not practical for a lot of folks. So outside of that, what else can you do? Reduce your use of plastics. So one of the main ways to do that is to drink water from glass or stainless steel bottles. If you're microwaving something at home, make sure that you don't microwave anything in plastics. Microwave it in appropriate microwave safe glass containers. You can also choose organic food at the grocery store. So multiple studies have shown that people who eat a greater proportion of organic food have a lower amount of these environmental chemicals in their body, and that is at least theoretically associated with health benefits. Sometimes it's difficult to buy everything organic. I encounter that challenge myself, and so that's where the Clean 15 and the Dirty Dozen list, which is published by this great organization, the Environmental Working Group, can be really helpful. The Clean 15 are those 15 produce items that have a low amount of agricultural residues and pesticides and chemicals on them. So you don't necessarily need to purchase them organic. So if you're going out, you can buy a regular onion and not worry about it. The dirty dozen, however, are those produce that contain a lot of chemicals and agricultural residues, etc. So these are things that you probably want to choose organic if you can. For instance, my son loves strawberries, and so I'm always sure to purchase organic strawberries because they are at the top of the list in terms of their agricultural chemical residue. And this list does change. So at the top of this graphic, you see 2017. There have been updated lists that have been published since then. I think kale has been added to the dirty dozen. So Environmental Working Group is a place that you can go to find that Clean 15 and Dirty Dozen list. Environmental Working Group, as you can see on this slide, has a lot of other resources as well. So you can search consumer products, so cleaning, household cleaning items, personal care products, and you can get an assessment of the chemical composition of those things in relation to your health. So the Environmental Working Group is a wonderful place to start looking at some of those things. So lifestyle element number 2 is eat healthfully, or eat a healthy diet. My personal formula when it comes to consulting with clients on eating healthfully looks a little bit like this. Number 1 is to pick a general dietary pattern to start with. So that is sort of the 10,000-foot view of what someone's diet actually looks like. And then to that general dietary pattern, you can add specific functional foods or foods that are known to have a particular effect. And of course, those functional foods will be picked based on that individual client's, the details of their diagnosis and their medical history, etc. And then you subtract from that specific food intolerances. So some people simply can't tolerate dairy products, or they can't tolerate gluten, or they can't tolerate other things. And so you subtract from that food intolerances. So the topic of general dietary patterns is far too vast to cover in any sort of real depth here. But one example that I would like to talk about is the Mediterranean diet. This is a general dietary pattern that I often suggest to my clients as being a great place to start in terms of building an anti-cancer diet. And beyond anti-cancer, the Mediterranean diet has been shown to reduce the risk of heart disease and stroke and diabetes and arthritis and osteoporosis and depression and anxiety, and the list goes on and on. There's a tremendous benefit of a general Mediterranean dietary pattern. So this, at least academically speaking, is what the Mediterranean diet looks like. So there's sort of 3 categories of foods to think about. The first are foods that are actively encouraged. These are foods that are connected with a specific benchmark in terms of how often you eat them, whether it's a number of servings per week or what number of servings per day. The next category are foods that are in the consume as desired category. So you can eat them if you like them and choose to, but they're not connected with a specific benchmark per se. And then there are foods that are actively discouraged. So quickly, roughly speaking, those foods that are actively encouraged include chicken, poultry over red meat. So anytime you can replace beef or pork with chicken or turkey, that's viewed as being beneficial from a Mediterranean diet standpoint. Fish and shellfish are included with the benchmark of 3 or more servings per week. Extra virgin olive oil is hugely recommended as a part of the Mediterranean diet, with the benchmark being 4 or more tablespoons per day. Nuts and seeds are a big part of the Mediterranean diet, and those are encouraged to be consumed 3 or more servings per week. Beans and legumes, 3 or more servings per week. Vegetables, 2 or more servings per day, one of which is raw. Sofrito is a component of the Mediterranean diet. Sofrito is essentially if you take tomatoes, chop them up, and simmer them with onions and garlic in olive oil. That is a basic sofrito recipe. There's a lot of regional variation on sofrito that will include different spices, but sofrito is delicious, and it's definitely a recognized component of the Mediterranean style diet, with the recommendation being 2 or more servings per week. And then fresh fruit, 3 or more servings per day. Foods that fall in the consume as desired category are dark chocolate, eggs, low-fat cheeses, to which I would also add low-fat yogurt, and whole grains. And then things that are actively discouraged include baked goods, things that are high in processed grains, white flour, that kind of thing, and sugar, added sugar. And then red and processed meats like bacon and sausage are discouraged. Spread fats like mayonnaise and high fat dairy products like full fat yogurt and butter, etc. Those things are discouraged. And soda. Soda is actively discouraged. So the Mediterranean diet is a wonderful, inclusive dietary pattern. It's sort of a in and of itself, and it also makes a great starting point for a lot of folks who are looking to make dietary changes. And there's a tremendous body of evidence to show that there's very, very meaningful health benefits associated with a Mediterranean style diet. So the next sort of eat healthfully category is functional foods. So these are specific foods that are connected with specific benefits for specific individuals. So obviously I can't cover every single functional food that's out there, but an example would be, a well-known example would be oatmeal for lowering cholesterol, or cranberry juice for the prevention of urinary tract infections. Those are perfect examples of functional foods. So in the oncology sphere, fish. So as mentioned, fish is an integral component of the Mediterranean style diet. And there is one study to suggest that the consumption of fish that are high in omega-3 fatty acids is associated with a 25% reduction in breast cancer recurrence. So for my breast cancer clients, that is a very specific functional food recommendation that I make, that they get at least 3 servings a week of fish that are high in omega-3 fatty acids. Another functional food example would be nuts and seeds. So one study found that for people diagnosed with colorectal cancer, eating 2 or more ounces of nuts per week lowered their risk of cancer recurrence by as much as 42%. So again, that is perfectly consistent with the Mediterranean style diet. Some of my clients choose to eat nuts every single day as a result of this evidence, and I have no qualms with that. Nuts are extremely healthy. So food intolerances is the next component of sort of how to eat healthfully or build a healthy dietary pattern. This is something that is extremely individualized. So individuals can be sensitive to a wide variety of foods. There are tests that are commercially available that supposedly can help to identify food sensitivities. I have found that they're not necessarily the most accurate or reliable, and I personally tend to recommend something called the elimination and re-challenge diet for identifying food sensitivities. But the point is, to achieve sort of the healthiest individualized dietary pattern, making sure that you're not eating any foods to which you're dramatically sensitive to, is important, is an important component. And that really needs to be done on an individual basis under the guidance of somebody who knows how to identify those sensitivities for you. So Lifestyle Medicine Foundation number 3, form and maintain relationships. So human relationships are extremely complicated. Again, this is something that's very, very difficult to boil down in sort of the reductionist approach to science and research that we use. So it's hard to study, is my point. That being said, there is evidence to show that a person's appraisal of their own social support is associated with improvements in their overall cancer outcomes. So cancer patients that feel self-appraised that they've got great social support from family and friends and community have a tendency to have a better outcome with regards to their cancer diagnosis. So this is one of the things that I frequently talk with my clients about. And if I happen to identify that there might be some friction in one of the important relationships in their life, then the action step to take after that is perhaps something like counseling. That's been profoundly helpful for a good number of clients to either go into individual counseling to help them sort of work through some of those relationship issues, or couples counseling if it happens to be with that person's partner. So forming and maintaining healthy and supportive relationships is an important component of the lifestyle medicine approach. Foundation number 4 is improving sleep. So in 2019, the International Agency for Research on Cancer classified night shift work, so that is essentially working at night, sleeping during the day, as being probably carcinogenic to humans. In addition, there's also evidence to suggest that things like short sleep duration, that is not getting enough hours of sleep per night, and sleep breathing disorders, of which sleep apnea is a prime example, also can increase the risk of developing cancer in the first place, and also worsen prognosis once you've been diagnosed with cancer. So looking at the quality of your sleep is an important component of lifestyle medicine. The National Sleep Foundation was recently kind enough to publish an interesting paper that looked at some basic parameters of how you might define quality sleep for yourself. So these are the 4 main parameters that were published in that paper. So number 1, sleeping at least 85% of the total time you're in bed. So when you go to bed and you fall asleep, you are asleep for the vast majority of the time that you're actually in bed. Number 2, falling asleep in 30 minutes or less. So this is what we call sleep onset latency. And we want to make sure that you're not laying there for an hour or even 2 hours before falling asleep. That is grounds for taking some action to improve the quality of your sleep. Number 3 is waking up for no more than 5 minutes once per night, or twice for adults. So this provides allowance for you to wake up and use the restroom, but then you go back to bed and fall asleep rather quickly. That is consistent with good sleep. If you go back, you wake up, use the restroom, you come back, and it takes you another hour to fall back asleep, that is indicative of poor quality sleep. And then being awake for 20 minutes or less after initially falling asleep. So once you fall asleep, again, you pretty much spend the majority of your time asleep, as opposed to tossing and turning or waking up frequently. In addition to those recommendations, the basic guidelines would suggest we should be striving for 7 to 9 hours of sleep per night, and that when we wake up in the morning, after about 30 minutes or so, we should feel well rested and clear-headed. And so those are other parameters by which you can sort of figure out if you're getting good quality sleep or not. So lifestyle medicine modality number 5 is to increase physical activity, exercise, essentially. So the amount of evidence about exercise in cancer is vast. It surpasses that of virtually all these other lifestyle modalities. rivaled only by maybe dietary recommendations. So I've just taken a small sliver of some of the available evidence to sort of illustrate my point. A 2012 meta-analysis found that regular physical exercise improved outcomes for people diagnosed with breast cancer and colon cancer. A 2014 meta-analysis found essentially the same results, that people who engage in regular physical activity after being diagnosed with breast cancer or colon cancer had significantly better outcomes than people who did not get physical activity. So when we talk about physical activity or exercise, you can think of it as being divided into at least 3 different categories. So number 1 is aerobic exercise, anything that gets your heart rate elevated. So that could be walking, running, bike riding, jumping rope, dancing. The next is flexibility training. So exercises that increase the pliability of your soft tissues, your muscles, your tendons. Yoga, Pilates, basic stretching, that falls into the category of flexibility training. And then strength training, resistance training, body weight exercises or weightlifting, anything that encourages your muscles to get stronger. So those are the 3 categories of physical activity that you should think about. And there are guidelines associated with each of those categories. So for aerobic training, essentially what you're looking for is a minimum of 150 minutes per week. So think of 5 30-minute sessions per week of walking or running or dancing or biking or something that gets your heart rate elevated. For strength training, it's 2 or 3 sessions a week at a minimum. Ideally, those strength training sessions are going to be engaging all of the major muscle groups in your body, so upper body and back and lower body and that kind of thing. You can do that in the gym with weights. You can do that at home with body weight exercises, but the point is you want to be exercising the full body, strength training 2 to 3 times per week. And then flexibility training or stretching, the goal is 2 to 7 sessions per week. Flexibility training is good to couple with aerobic exercise. So after you go for your walk or your bike ride or your run or whatever it is that you do, once you get your core body temperature up, that's a great time to do a little bit of stretching afterwards. Reduces the risk that you might pull a muscle or be injured in that stretching activity. So that's a good time. So walk for 30 minutes, stretch for 5 minutes when you come home. So lifestyle medicine modality number 6 is to manage stress. Stress has gone through the roof for everyone in the last 12 to 18 months. Thank you, COVID-19. There's a ton of evidence about the negative impacts of chronic stress on health. I've pulled one specific example here. So chronic stress suppresses elements of the immune system that are responsible for combating cancer cells. And so chronic stress would be expected to be a negative influencer when it comes to the risk of cancer recurrence after treatment. Chronic stress might even impair conventional treatment by impairing immune function. And so chronic stress is something that's important to tackle and to deal with. So what can you do about it? One example of something you can do about it is meditation or mindfulness training. So meditation, mindfulness training has been shown to improve physical and psychological health in people diagnosed with cancer. So it's been shown to reduce depression, anxiety, insomnia, and other markers of stress. It's also been shown to enhance immune function. So that is consistent with our understanding of the impact of stress on the body. By mitigating some of the effects of stress, you can get better immune activity and help those immune cells go after any cancer cells that might be present. So I'll be the first I'll be the first to acknowledge that meditation and mindfulness is not for everyone. You might be one of these people that, you try and sit there to meditate and you fall asleep right away, or you get distracted right away. If you fall asleep right away, that might be an indicator that you're a little sleep deprived, and you might want to look at the quality of your sleep. And if you get distracted, then that might be an indicator that you actually do need a mindfulness meditation to sort of help bring your conscious awareness into the present moment. That being said, meditation is not for everyone. And so there are other strategies for reducing stress. One of the strategies is what's referred to as nature therapy or forest bathing. Really, really interesting body of research on this. Apparently, exposure to natural environments, whether it's something like walking through the forest or spending time on the beach, as well as being exposed to natural materials like woodworking, or even something like gardening or working with houseplants, has been shown to measurably alter the body's stress response and impact immune function. So nature therapy, if you don't happen to be a meditator, that's not your cup of tea, so to speak, nature therapy is something that you might pursue instead as a means of managing your stress and reducing your body's physiologic response to the stressful circumstances in your life. And again, the research supports this idea that nature therapy improves immune function and can encourage physiologic relaxation in people. So that was lifestyle medicine. Another major component of integrative oncology is natural medicines. So natural medicines, I group into three categories. Number one is botanical medicines. Number two is mycological medicines or mushrooms. And number three is nutritional supplements, nutritional medicines. So let's tackle those kind of one at a time and provide some interesting examples. So botanical medicines. Botanical medicines would refer to anything that is plant-based. So you can take flowers, leaves, roots, and make them into teas or powders or tinctures for the purpose of achieving a particular medicinal effect. Botanical medicine is really one of the oldest forms of medicine on the planet. There's a vast body of traditional knowledge and a vast body of science-based or evidence-based knowledge to guide us on the use of plants for the improvement of human health. One great example is this. This is Astragalus root. Astragalus is used very, very, very much in traditional Chinese medicine. And there is a robust body of evidence to show that astragalus has many benefits when it comes to cancer treatment. This is one example. One meta-analysis found that the combination of astragalus root alongside of platinum-based chemotherapies like carboplatin or oxaliplatin, which are used in the treatment of multiple cancer types, not only reduces side effects of those treatments, but also improves outcomes. So patients get a better treatment response when they combine that conventional treatment with astragalus root. So this is a great example of a botanical medicine that can be used in an integrative fashion to improve patient care. Another example is green tea, something as simple and common as green tea. Regular green tea consumption, which is defined as 3 to 5 cups per day, has been shown to reduce breast cancer recurrence risk by anywhere from 19 to 27%. So this is a pretty simple habit that an individual with a history of breast cancer can get into to sort of reduce their risk of having a breast cancer recurrence. A lot of my clients will get in the habit of making a pitcher, literally a pitcher of green tea in the morning. They can put it in a thermos or put it in the refrigerator. And then their goal is to sip on that green tea throughout the course of the day. End of the day, the goal is 3 to 5 cups. Another great example of a botanical medicine is coffee, believe it or not. So in some circles, coffee is shunned as being not healthy, but the vast majority of evidence shows that coffee for most people is quite healthy. And here's a very specific example. Regular coffee consumption, 2 or more cups per day, has been shown to improve outcomes after colon cancer diagnosis. So colon cancer patients that after they're done with treatment and achieve status of no evidence of active disease, they continue to consume or start to consume coffee, 2 or more cups per day, have a better outcome and a reduced risk of a recurrence of their cancer. It's because coffee is chock full of wonderful phytochemicals that have a lot of health benefits for people. So coffee is a botanical medicine that can be incorporated into the daily routine as well. So another category is mycological medicines, that is medicinal mushrooms. So one really cool example that was published recently is systematic review showed us that culinary mushrooms, mushrooms that you cook and eat, are associated with a reduced risk of developing cancer in the first place. And this was multiple cancer types. So having a few servings of culinary mushrooms per week can reduce your risk of developing cancer in the first place. By extrapolation, we would expect it to reduce the risk of a cancer recurrence after you've been diagnosed and treated. And that brings us to the very specific mushroom, Coriolus versicolor. It's also known as Trametes versicolor, or the common name of it is turkey tail mushroom, which you can see these look like a collection of turkey tails, hence the name turkey tail mushroom. Turkey tail mushroom has been widely studied for a long time. There's a tremendous body of evidence about it having wonderful benefits for people diagnosed with cancer. And what we see from this meta-analysis is that folks who took turkey tail mushroom alongside of conventional treatment or just after conventional treatment had a significantly improved outcome compared with people that did not incorporate turkey tail mushroom into their routine. And this is likely because turkey tail mushroom stimulates immune function. So you get those immune cells going after cancer cells during conventional treatment or just after conventional treatment, and you get a better outcome. The third category of natural medicines is nutritional medicines, so things like vitamins and minerals and protein powders, etc. This is a vast category. There's way more that I could talk about, certainly in this presentation. But one example that I would like to highlight is melatonin. Melatonin is well known by lots of folks for sleep. So melatonin can help if you have difficulty falling asleep at night. Usually it's used in the 1 to 3 milligram kind of range. But there's a pretty significant body of research to show that melatonin, especially when it's used alongside of conventional cancer treatment, improves outcomes for people with a wide variety of cancer types. So it improves the response rate of cancer to conventional treatment, and it significantly reduces a wide variety of treatment side effects. So melatonin is a great example of an integrative natural nutritional medicine that can be incorporated as a part of integrative oncology. So I hope that you have found this presentation interesting and thought-provoking. Couple of closing thoughts. I would once again like to highlight the fact that integrative oncology really needs to be delivered by an interdisciplinary team. If I were diagnosed with cancer, I would absolutely be seeking out the best medical oncologist, radiation oncologist, and surgical oncologist that I could find. Many of them that I would go to actually do work at Baptist MD Anderson. And so that is a very, very important part of one's cancer treatment team. But there's a lot of other healthcare professionals that can be integrated into that mix. Nutritionists and nurse practitioners who've got not only their core skills, but additional interest and training in integrative medicine, acupuncturists, and certainly naturopathic doctors and naturopathic oncologists. as a way of bringing all these tools into your cancer treatment to help you as an individual achieve the best possible outcome that you can. So again, I thank you for listening and would be more than happy to take any questions that you have right now.
Thank you, Dr. Robinson. One of the questions that came on the chat during the presentation is how to schedule an appointment with an integrative oncologist like yourself, and what would they expect on their first visit?
So certainly anyone can schedule an appointment with me. My business name is Wellness Working Group, so wellnessworkinggroup.com. You can contact me via my website, and I would be more than happy to schedule an appointment. I'm currently seeing people remotely, so this is phone or Zoom consultations. There are other avenues for finding integrative oncologists. There's the Oncology Association of Naturopathic Physicians that provides a directory of other naturopathic oncologists. There's the Society for Integrative Oncology that also provides a directory for other allied health professionals that practice integrative oncology. And in terms of what to expect, the initial consultation in most regards is going to be a little bit longer than you might expect. I spend a minimum of an hour initially with clients, sometimes much more than that, as a way of getting an accurate understanding of what their lifestyle is, their medical history, their personal goals, that kind of thing. There's a lot of information to collect to be able to make focused and targeted recommendations for people. So you can expect a lot of questions at the first appointment about really who you are as an individual and how you live, and what it is that you're personally trying to achieve with natural medicine. So that's likely what you can expect from the initial consultation.
And is integrative medicine or integrative oncology, the question states, only for those in active treatment, or those who are done with treatment or are high risk for cancer patients or cancer occurrence?
Yeah, that's a great question. So no, natural medicine and sort of the integrative approach can be incorporated anytime. And I actually think it should be incorporated anytime. So if you're an individual who's at high risk for developing a particular cancer type, then a consultation with an integrative practitioner as to get guidance on how you might reduce your risk, I think would be very, very beneficial. It certainly can be beneficial if you're actively receiving any form of conventional treatment. And then afterwards, if you are able to achieve this state of no evidence of active disease, and you're in a place where you're trying to reduce your risk of your cancer coming back, that's also a wonderful time. The vast majority of these lifestyle practices and natural medicines can be quite helpful for reducing your recurrence risk.
And I think last question, reading it now, you mentioned a lot about the immune system.
Mm-hmm.
How does the immune system and cancer marry together?
Yeah, that's a great and very complicated question. So for cancer to develop in the first place, so I'll take a step back from that. Our natural immune system, one of its functions is to identify precancerous and cancerous cells and clear them from the body before they have a chance to grow into a larger tumor. So any cancer that has developed has in some way evaded that natural immune system control. That could be, there could be a wide variety of reasons for how that happened. What we see, especially with some of the advent of these more modern immunotherapies from the conventional side of things, is that they can, in certain circumstances, be quite effective at upregulating the immune system, helping the immune system to recognize cancer and cancer cells and to go after it and do their job of getting rid of them. This has been a theme that's been present in natural medicine and integrative medicine for a very, very long time, all the way back to traditional Chinese medicine, where they will use herbs and mushrooms that are known to stimulate immune function as a way of supporting anti-cancer, natural anti-cancer effects. So I think the take-home point is anytime you can functionally upregulate the immune system, whether that's during conventional treatment or after, and encourage the immune system to recognize and go after cancer or precancerous cells, the better off you're going to be. And I think there's a ton of research to support the idea that that is true, and that is a very meaningful therapeutic goal to try and achieve with people.
Well, thank you so much for joining us. If you guys have any questions, feel free to reach out to the Baptist MD Anderson Cancer Center, and we'll help you get connected with Dr. Robinson. And have a blessed day and be well. Bye, Dr. Robinson.
Bye-bye. Thank you for having me.
Thanks. Bye.